And now we move on to topical issue number 3, in the name of Deputy Seán Kyne to the Minister for Health, the need to develop a heart failure strategy here. Deputy, 4 minutes.
And first of all, I'd like to thank the Controller's Office for selecting this topical issue. Minister, as you're aware, yesterday was World Heart Day, and it was fitting that in Brussels the Heart Failure Policy Network launched a policy toolkit to tackle heart failure. The aim of the Heart Failure Policy Network is to create a lasting network of politicians working with other stakeholders to lead significant policy changes to improve the lives of people with heart failure in Europe. And Ireland has 2 representatives in the network thus far, myself and Neil Johnson, the Chief Executive of CRE, the West of Ireland Cardiac Foundation, an organisation, as I'm sure you're aware, undertakes excellent work in the West. Minister, you'll already know that heart failure is a chronic condition which often requires inpatient hospital treatment. It occurs when the heart is unable to pump enough blood to meet the body's need for oxygen and important nutrients. And the condition affects at least 15 million adults across Europe, and 1 in 5 people in Europe are at risk of developing the condition. In Ireland, over 90,000 people live with the condition, is responsible for somewhere in the region of 600 to 700 deaths annually. Most worryingly is the increasing prevalence of the condition, with thousands of new diagnoses each year. In fact, heart failure is the leading cause of hospitalisation among the over 65s across Europe, and accounts for 5% of all acute hospital admissions. And unsurprisingly, this is a condition which has a huge negative impact on people's lives and quality of life. For too long, heart failure has been the forgotten condition in health policies, despite the economic impact on healthcare conditions and the terrible burden caused by people with the condition. However, we can change this, and the policy toolkit provides 10 priority actions backed up by clinical evidence, the views and experiences of patients, as well as setting up the economic case for change. And I believe that we need to make heart failure a national health priority. We can do this by establishing a national strategy, by increasing public and clinician awareness of the condition, and by investing in reliable data to support policy decisions. We also need to ensure timely diagnosis, which can be achieved providing specific training for medical staff. We need to introduce multidisciplinary person-centred care, and this would include treatment plans that are consistent and available nationally, dedicated follow-up care with specific points of contact for patients, and outpatient care to try and avoid further hospital admissions. All patients with heart failure should be offered a personalised long-term care plan to help them self-manage their condition. And finally, we need to expand primary care to include medical staff trained in heart failure care in a way which will facilitate the care of people in their communities. And I welcome the work that has already been undertaken here with the Heart Failure Programme. The objectives and aims of that programme readily complement the Heart Failure Networks, and the programme was certainly going in the right direction. However, the last update of the programme was in 2012, and while some hospitals were taking part, they were mainly on the East Coast. And I firmly believe that with a renewed effort, we could successfully meet the challenges posed by heart failure. I attended the launch of the policy toolkit yesterday in Brussels, and there was a wide variety of politicians, clinicians from across Europe there. It's not an issue that is alone common to Ireland. It's across Europe, some 15 million people impacted upon. And from hearing from patients or from specialists in other countries, there was guys there from Italy and France who spoke about their own conditions, people who had suffered heart attacks and heart failure without any follow-up, without any long-term personalised care plan. So this is something, as I said, that impacts across Europe, and I believe there's a great opportunity and a great need to develop the toolkit strategy that is being espoused here. Thank you.
Thank you, Deputy Minister Lynch. 4 minutes.
Thank you very much, Cathaoirleach, and I would like to thank Deputy Kyne for raising this issue. He's quite right in everything he says. It is not just an Irish problem, but indeed an international problem. I suppose when you take a look at what Europe does well, it's when it does things together. And World Heart Day was founded in 2000 to inform people about heart disease and its prevention. This year, the theme is creating heart-healthy environments. The day is intended to spread awareness that premature deaths from cardiovascular disease can be avoided if the risk factors, including tobacco use, unhealthy diet, physical inactivity and harmful use of alcohol, can be controlled. I'm sure the Deputy heard all of this yesterday. Healthy Ireland provides a framework which supports heart-healthy environments. It includes strategies on tobacco and alcohol. The Department is currently revising its health eating guidelines and is developing an obesity policy and action plan which will be finalised this year. The Department of Health's Changing Cardiovascular Health Policy 2010 to 2019 was launched in 2010. Subsequent to that, the HSE established 3 key clinical programs for acute coronary syndrome, heart failure and stroke. Significant improvements have been made with regard to access to acute treatments for coronary heart disease and heart failure, as well as the development of stroke units across the country. Heart failure is one of the major chronic diseases in Ireland today and is one of the commonest reasons, as the Deputy has pointed out, for hospital admissions in the elderly, often requiring a prolonged stay. It is recognised that integrated management programmes for heart failure, encompassing primary care and hospital services, can produce significant reductions in the need for hospitalisation and achieve better quality of life and outcomes for patients. The HSE National Clinical Programme for Heart Failure aims to recognise the way heart failure patients are managed. Recent developments include structured services for the management of acute heart failure. Structured services for acute heart failure have been established in 11 hospitals at national heart failure units. These sites have introduced a structured specialist hospital service for patients presenting with acute heart failure, including post-discharge follow-up. They deliver an integrated service through the model of care developed by the National Clinical Programme for Heart Failure, which follows international best practice. A new diagnostic clinic in the Galway Wexford St Vincent's University Hospital Group provides direct access for general practitioners to specialist blood tests and echocardiograph in the community, with remote specialist advice on echocardiograph results and specialist review of patients in the community when required. This improves access for patients to diagnostics and specialist advice. A heart failure integrated care demonstration project in the Carlow-Kilkenny region is planned to commence shortly. It will demonstrate integration between primary care, secondary care and the hospital groups. This uses existing e-health technology and will strengthen patients' self-care with enhanced nursing supports and training. Coordinated care between primary and secondary care will provide rapid access to specialist opinion, support and will support identification of heart failure patients in the GP practice. It will also provide specialist day care advice to general practice for rapid but non-urgent cases. Appropriate use of specialist advice and avoiding need for hospital and outpatient attendant has been a key target of this programme. Recognising that giving GPs access to senior specialist advice in a structured and timely manner will avert the need for OPD and emergency department referrals.
Thank you, Minister.
And it led to the development of a consultant and will lead to a development of a consultation service where GPs, practice nurse and specialist staff interact using web conference technology to discuss and manage cases collaboratively. This will also allow simultaneous education for healthcare professionals as they discussed relevant care.
Thank you, Minister.
I'll deal with the rest, Deputy, in the supplementary.
Thank you, Minister, for your reply, and I certainly welcome the contents of the reply, and particularly in relation to the National Clinical Programme for Heart Failure. And I believe that the Health Failure Policy Toolkit can have a role in this, and as I said, it is something that has been rolled out across Europe, and I certainly think that there should be liaison, and I intend to follow up with the Department of Health in relation to it. As you have acknowledged yourself many times, I'm sure there's constant negativity in many ways around our health services, and the negativity is so pervasive and persistent it often overshadows and ignores thousands of positive results and outcomes every day in every hospital, in every primary care unit in our health service. And the negativity is bound to affect morale of staff, etc. However, can it be used to detract from the task ahead of us, and ensuring the health service is efficient and provides timely, effective treatment is a mammoth task. As I said, I acknowledge the Department of Health's role in receipt of demands regarding all illnesses and conditions. It's a very difficult task, deciding how to allocate resources, particularly when there's constant strains on the national resources. And I know back in 1996 in the National Cancer Strategy under a previous Fine Gael Labour government, and over the course of that strategy and its successors in 2006, cancer services have been transformed. So I hope that this can also happen across the country in a unified approach, and across indeed Europe, taking on board the best practice and the best models. And I believe the Health Failure Policy Toolkit can work. And credit where credit's due. The previous strategy, the previous Minister Harney, in relation to the cancer care, has worked in many ways and has contributed to improved outcomes. Ultimately, the improvement of the cancer have proven beyond doubt that the positive benefits of the development and use of clear national strategies. So I certainly hope that this can be done in relation to heart failure as well. It's no different, and I would urge you to take aboard the contents of the policy toolkit and develop a strategy for tackling this condition in conjunction with that has already been planned and rolled out. As our country ages, grows older, this condition is going to become more prevalent, and one that will cause more serious issues, both financially, that will also land on the desk of the Department of Health.
Minister Lynch.
I'll be very brief. I do thank the Deputy for raising the issue, and it is a significant issue, but I think 3 of the 11 hospitals are outside of the Greater Dublin area, Wexford, Cavan and Sligo. And I would agree with you that there should be one in every significant area of population, and also we have to move it out of, I'm constantly saying that the solution to overcrowded hospitals is within primary care, and this is really where this programme needs to go. Just this morning we launched the diabetes in primary care programme, and that will be delivered throughout the country in a primary care setting, and it's that management of a chronic disease, and this is where this programme needs to be as well, and clearly that's where it's heading. And we will be adding more, I suppose, management of chronic conditions into the primary care sector, and I would say that this would be one of them where we will do that. Of course, I don't. And I know the Deputy doesn't either, but you have to make your case. I don't believe in the sort of doomsday scenario. I think that if Healthy Ireland has an impact on how we live our lives in relation to the issues which we can ensure we won't end up in heart failure, like abuse of alcohol, tobacco, inactivity, I believe that the future can be an awful lot brighter. But for those, and there will always be a significant group that will end up with heart failure, then we need to ensure that they are managed in their community where they feel most comfortable and where they are best known, and the acute hospital really should be a last resort, but it is a significant issue, Deputy, and I thank you for raising it.
Thank you, Minister Lynch.